The Mylan EpiPen nightmare, well, it continues. Mylan's still in damage control mode for skyrocketing EpiPen costs for the life-saving drug. Now, the company expanding access to the product, not by lowering the price, but by creating, well, a savings card, the one you see right here on your screen. That will cover up to $300 of its EpiPen 2-pack. But is it a savings card really the answer? Outside experts claim the overall impact of the card will likely be very small and is not a solution to the broader problem. Now, yesterday on Countdown, former Mylan specialty spokeswoman Kelly Rudnicki shared why she resigned and then offered her 2 cents.
A coupon's just not enough at this point. It's too little, too late. Heather needs to step down. We need to do damage control on this. She owes a stronger explanation to consumers who rely on Mylan and EpiPens to keep their children safe.
Well, RX Saving Solutions CEO Michael Ray joins us now live in a Fox Business exclusive. Michael, thank you so much for being here. You're the CEO of RX Saving Solutions, so you help companies and their employees get the best possible deal for their health plan. Is that right?
That's right. That's exactly right. We work with health plans and self-funded employers. You know, and we're about more than just cost. We're about therapy options as well. And so there's a discussion happening that includes, you know, what is the price of the drug. We really focus on taking a clinical approach to solving the problem.
So you're the guy that looks at costs, so you're very well aware of what goes on in the pharmaceutical world. Are you surprised by the cost being charged, the price being charged by Mylan? You
know, I'm actually not. I feel like I've seen this happen over and over.
Really?
We've seen Congress bring people to Washington and publicly scold them, but it's not changing. It just continues to happen in different variations and forms, and it's just not surprising to see again.
So they're offering this $300 savings card. Critics will say, well, that's not the solution. What do you say?
Yeah, I think it's a Band-Aid. I think that it's a way to calm some very outraged Americans who are, you know, have big sticker shock. But at the end of the day, it's not a lower price. Third-party payers, health plans, self-funded employers, they're still paying rack rate. And that's not going to work if you really want to.
The big issue here is that they've basically got the monopoly. There was another one that was recalled by the FDA from another company, and then another one that was submitted and was rejected by the FDA. So Mylan's the only game in town.
It's actually not, and so that's a big kind of myth floating out there. And a lot of people don't know. I saw the senator from Minnesota yesterday. She was making that statement, and in fact, epinephrine's been around and commercially available since 1939. 77 years.
So why isn't there another product out there that's more reasonably priced?
Yeah, well, there is. There's actually a different delivery device than the one that EpiPen has. And so actually, if you're willing to take 2 caps off of a pen...
But it's harder to use. That's the complaint.
Well, how long does it take to take 2 caps off? I mean, that's the question. And when it comes down to...
But it's the same delivery.
Same delivery, same dose, same active ingredient. And, I mean, it's hundreds of millions of dollars in potential savings by using that versus the EpiPen. Hundreds of millions. Did the
marketing of Mylan smear it, though? Was that a concerted effort to say, you don't want to use that, it's very difficult, use ours. Ours is simple.
Sure. I mean, you know, they've done a very effective job of branding. And, you know, what our whole company stands for is really making sure that people know what their options are, not just, hey, I saw this commercial, I saw this in the doctor's office. I know that there's this other product that I can use, and it can save me hundreds of dollars.
But that alternative is safe and could save lives, right?
I use it for my kid.
You use it for your child, so there you go. There is an alternative.
There is an alternative.
And it's a lot cheaper?
A lot cheaper.
Very good. Michael Ray, RX Saving Solutions CEO. Thanks so much for being here.
Thanks for having me.